What is the best treatment for under eye bags? I've had these under eye bags my whole life, and I don't like the way they make me look. I'm tired of being mistaken for looking sad or sleepy when I'm not. I have tried every remedy in the book, and they had no effect on me whatsoever. Makeup does nothing to conceal the shape of the bags as well as the puffs. I really want to know what my options are as far as removing them and which option is best for me based on my picture. Thanks.
Thank you for your question. You've asked, what's the best treatment for under eye bags? Well, it's good that you're asking this question in a forum where physicians will answer, because many of our patients, as a specialist in oculofacial plastic surgery, have come to me with bags and bags and bags of over-the-counter, guaranteed to get rid of puffiness creams which do nothing. And so you described the typical concerns and experiences that our patients have, where they say they have bags no matter how much they sleep, they always look tired, and makeup and cover-up doesn't help. So when you ask the question, what's the best approach, let's first learn about what the cause is of the under eye bags. The under eye bags represent fat pockets, and this is a term that's referred to called lower eyelid fat prolapse. What that means is the fat that's normally around the eyes pushes forward and creates a bulge. Typically, this is a genetic trait. It can happen as early as the teen years, and it can happen throughout the lifetime of an individual. In fact, it actually transcends age, ethnicity, you name it, gender. Bags under the eyes has to be one of the most common procedures that I treat in my practice. Now, many years ago, plastic surgery traditionally approached the bags with one approach, which was what's called a transcutaneous approach, or an incision on the outside. And most general plastic surgeons were trained in this one technique. In the late 90s, I actually wrote an article called Ethnic Considerations in Eyelid Surgery. I realized that for different skin types and different ethnicities, we had to customize the approach to the eyelid appearance and compensate in many ways to the different anatomical aspects of each ethnic group. So from my experience, someone like yourself, if you were to come to my practice, I would perform something called a transconjunctival blepharoplasty. What that means is I would get to the fat pockets from the inside, I would remove and reposition as is appropriate, and then you would have no incision on the outside. People of dark skin have a tendency to have some type of mark if the incision is done on the outside. Not everyone, but that's a risk that is not usually necessary in someone who is in the young to middle age group, as long as there's no extra skin. And most of the time, what is perceived as extra skin is not extra skin. The bulge of the fat pocket skin will then basically, it's called a convexity. When the fat is removed, has to go and follow the same surface area or a relative concavity. In addition, in the past several years, I've had a lot of success applying a material called platelet-rich plasma. What I'm doing essentially is using your own platelets so that basically drawn from your own blood, like in a regular blood draw when you go to a lab, spinning it until we get this part of it that is concentrated with platelets. What platelets are is the natural way of the body to heal. And there are all these growth factors that help improve skin quality. So I would typically combine lower eyelid blepharoplasty or transconjunctival blepharoplasty with platelet-rich plasma. In my practice, we routinely perform this procedure under local anesthesia with light IV sedation, which means that you're not under general anesthesia. We do this with what's called sometimes twilight anesthesia, and our patients are able to typically recover and get back to work in less than a week. So my advice to you moving forward is seek out qualified cosmetic surgeons and look for doctors who have a lot of experience with eyelid surgery as well as a lot of experience with darker skin. And once you're comfortable with the doctor's results, looking at their before and afters, etc., then move forward and take care of the bags under your eyes. So I hope that was helpful. I wish you the best of luck. Thank you for your question.